Functional assessment is seeing the range of motion available within the various planes of movement. Being demonstrated now is frontal plane movement. When assessing, you compare one side against the other. Frontal plane movement consists of adductions and abductions. Next is sagittal plane movement. These are flexions and extensions. When doing assessment, we're observing for symmetry, as well as ease of movement. When the client/patient is standing on one foot, we can also assess for balance mechanisms. Viewing from the side, we're able to take a look at what is effective in the range of motion of the neck and cervical area, torso and hip, and also the transverse plane, which is rotations, internal and external rotations. Compare each of the models as you watch this demonstration, noticing differences in movement in areas of bind, restriction, lack of movement, compensation, etc. Again, assessing balance mechanisms and challenging that to see if the person is able to stand efficiently on one foot. If they cannot do this, they're going to have trouble with their walking patterns. A full squat assessment gives us an idea of multiplanar movement. Look for areas that are binding and do not move, and areas that compensate for this by moving too much. Watch for adaptive mechanisms where the person might shorten or twist. Notice for instability, such as when the knees shake. Keen observation, practiced and mastered, really helps the professional massage therapist identify areas that need to be addressed with massage techniques because they are short and binding. Massage works best to lengthen tissues that are short and binding. In areas that are long and weak or inhibited and need to be strengthened. I'm exaggerating the position here so that you can see how the front is pulling forward so that the back is taut and long. Here I'm pointing out areas of lack of symmetry as well. And showing how I observe that the arm is rotated inward and the shoulder is forward. Here I've identified some lordosis with some core instability. We also have a concavity and a convexity. A massage would target the cave, the concavity. Concavity with long tissue. Shoulders are rotated. We have hyperextension of the knee. We have a definite rotation or torsion of the torso, which I've exaggerated. This model has a bilaterally anteriorly rotated pelvis with a lordosis. Notice the idea of the cave. We're going to assess for sacroiliac joint involvement. Pain would be increased in the joint that is dysfunctional as they lean back. An aspect of functional assessment is watching the efficiency of gait action. The arm should counterbalance the leg movement. To further assess for gait function, we're going to mimic gait action and muscle test to identify to see if muscle coordination is appropriate. In this instance, both should test strong together. But when the extensors are activated, because of the contralateral movement during gait, the muscle should let go, and it does. That's an appropriate function. Using the leg to send the message this time, having the client contract, and then again assessing for the arm, we see that we have appropriate function. Assessing for hip flexors against the extensors of the shoulder, those should let go. It should inhibit, and it does not. This is dysfunction. We're going to correct by reinforcing the appropriate action. The activity at the arm is a resisted active movement. Next, the opposite pattern will be assessed. In this instance now, the leg should go down, and it does not. Correction will be reinforcing of the appropriate pattern. The shoulder extensors are contracted, and utilizing a resisted movement, the muscles are encouraged to function appropriately. Then the area is reassessed and now is functioning more correctly. The hip flexors are now the control and sending messages to the arm. And those assess appropriately. Working with same side assessment, extensors and flexors should work together. And that is not the case. Both of those should be strong together. And so we're going to reinforce that pattern. And then reassess. The leg is now the control, and the shoulder extensors facilitate with it. This is appropriate. The shoulder flexors, however, should inhibit, and they did not. Correction would be to reinforce the appropriate pattern. Shoulder and hip adductors facilitate each other. So she's pushing together with her hands and should be able to hold the knees firmly. And she could. Reposition. Pulling apart should inhibit the adductor muscles, and they do not. Correction is to reinforce the appropriate pattern. Next, the hip adductors will be the control. Placing the knees together tight and pushing the hands together. Should result in a firm assessment. Activating the abductors should inhibit, and they do not. Correction is to reinforce the appropriate pattern. Activating the abductors work until the adductors inhibit appropriately, and then reassess. With the client in the prone position, extensors can be checked against extensors. But when a flexor is activated, the opposite extensor pattern should inhibit. And in this example, it does not function appropriately. Correction as is before. Now, hip extensors are the control and being assessed against the shoulder extensors on the opposite side and should hold strong together. Encourage the appropriate pattern. Position hip extensors again and assess the flexors of the opposite shoulder. They should inhibit. Reinforce the appropriate pattern. In the same side assessment, the shoulder extensors should inhibit the hip extensors, and they do. And flexors of the shoulder, when activated, should facilitate the hip extensors, and they do. Leg as a control, contract, and the flexors should remain strong, and they do. And when hip extensors are contracted, the shoulder extensors should inhibit.